This will be the proper aseptic technique for the insertion of a Foley catheter on a male. The first thing any clinician needs to do before any nursing procedure is wash their hands. So I would be at a hand washing station and wash my hands with soap and water, or I would use an antiseptic, alcohol-based gel antiseptic. Then I'm going to open up my catheter tray. It's a little easier to tear this off without any gloves on. And then I'm going to put on some clean gloves. These are available in the patient's room. So put my clean gloves on. There's no particular technique for that. Remove the contents from the bag. This bag can go either in the garbage, or some nurses prefer to use this as a garbage bag on the edge of the bed. These stickers are going to go to the side until the completion of the procedure. Instructions for use are here. The first step is to always open the tray away from oneself. So any aseptic technique, you want to open this away so that you are not leaning over your sterile field. Open away first, second flap, and third flap. The nurse never wants to touch the underside of this tray with her non-sterile gloves. So now underneath my third flap is my clean drape. And I'm going to place this drape, I'm going to move my patient back just a little bit. I'm going to place this drape shiny side down, and I don't want my drape to come into contact with my sterile field. So again, I'm going to move my sterile field back just a little bit there. And now I'm going to go ahead and complete peri-care on my patient. This kit happens to come with peri-care inside the tray. Throw that away. So I'm going to get my 3 soap wipes out, and I'm going to continue with peri-care of my patient. 3 times in a circle here. All right. 1, 2, 3. And once I have completed peri-care, I'm going to go ahead, and before I remove my gloves, I'm going to remove this drape. This drape was in place to catch anything that I was cleaning off of my patient. So I'm removing my drape. I'm going to remove my wall gloves, and every time a nurse or a clinician removes their gloves, they need to wash their hands. This tray happens to come with some alcohol-based hand sanitizer inside the tray. So without turning my back on my sterile field, without leaving my patient's bedside, I can go ahead and complete some quick hand antisepsis. At this point, now I can move my sterile tray up toward my patient again, being very careful, again, not to touch the inside of my sterile field. So I'm going to grab on the outside here, and I'm going to move this forward toward my patient. And again, I can pinch and pull this very last flap. The last flap of the tray always comes toward the nurse, toward the clinician. Now it's time for me to don my sterile gloves and begin the sterile portion of my procedure. My hands are dry for my hand sanitizer. Again, not reaching into the tray, but pinching my gloves out. And I need to put my gloves on in an area separate from my sterile field. Once peri-care has been completed and the sterile gloves are on, the sterile field has been moved close to the patient, now I'm going to move the tray back just a bit, again remembering that the outer inch of my CSR wrap is considered non-sterile, so I don't want this tray to touch the outer inch. I'm going to pick my tray top up, and I'm going to move it close to my patient. I'm going to continue prepping my field here. Again, mindful to pinch. This is called a fenestrated drape. I'm opening this over my field. I'm going to place my fenestrated drape on my patient. careful not to contaminate my own sterile gloved hands by touching the patient with it. And then I can tuck this down here. Okay, so now I've got my fenestrated drape on the patient. I'm going to continue setting up my tray. Open up my povidone iodine swab sticks. I'm going to take them out and place them on my field. I'm going to pour my povidone iodine, the remainder, on top there. I'm going to take my lubricant and I'm going to dispense it in the tray. This is important to dispense it because you want this lubricant to be equally distributed all over the Foley catheter that we're about to place in that lubricant. Again, disposing of my garbage without dropping below the level of my waist. So now I've dispensed this lengthwise here. I'm going to take my Foley catheter and I'm going to take this blue sheath off. I'm going to place this Foley in the lubricant here and it's going to stay. You can throw this blue sheath away. Now I'm going to connect my water syringe to my Foley, to my inflation port here. All right,